We begin treatment of the neck on the rear side, where the collection of muscles listed here work in unison to determine your neck alignment, posture, and comfort. The trapezius is a large surface muscle that extends from the occipital bone at the base of the skull to the lower thoracic vertebrae of the spine. Because of its position on the surface, it will be the muscle that the AcuLever will make direct contact with. Underneath the trapezius, the Splenius capitis and Splenius cervicus are muscles in the back of the neck that connect the skull and upper cervical vertebrae to the upper thoracic vertebrae. The Seminspinalis muscles of the neck are the upper collection of the erector spinae, a bundle of muscles and tendons located nearest the spine. The Levator scapulae is a slender skeletal muscle situated at the back and side of the neck. It originates from the transverse processes of the four uppermost cervical vertebrae. As can be seen in this image, there are a number of muscles in the rear neck and upper back areas working in concert to create smooth neck mobility and function. All of them will receive direct pressure and treatment from the AcuLever. The best way to think of this treatment is that two thumbs are pushing simultaneously and deeply into the sites, working downward from the skull into the upper back. The number of sites worked on is up to the user, but it's best to inch downwards in small increments to treat a maximum number of sites in this anatomical region. You will want to include the lever plate to achieve the maximum effect, but it is also quite effective to use just the Orca thin blade plate by itself. This video shows the combined action of the lever plate creating cross-fiber friction with its rocking motion of the thin blade plate. The first site is very easy to locate, literally the first area of muscle just below the skull. This site lines up with the first cervical vertebrae at the top of the spinal column. Lower your head slowly onto the AcuLever, making sure that your neck is perfectly centered between the thin blades. You will rest here for as long as it feels appropriate to begin the opening of the site. After this initial direct pressure, begin rolling your head side to side to create the deep tissue cross-fiber friction effect. You will feel the site begin to open. Then begin incorporating your shoulders, rolling them side to side in unison with your head. As you continue to open, roll your knees, shoulders, and head in unison to create the maximum cross-fiber friction deep tissue effect. You can see that the AcuLever has increased its rocking motion during the course of this technique. Inching downwards to the second site, the AcuLever will line up with the second cervical vertebrae. Reposition your body and lower your head so that it is centered between the fin blades. Rest here for as long as it feels appropriate to begin the opening of the site. After this initial direct pressure, begin rolling your head side to side to create the deep tissue cross-fiber friction effect. You will feel the site begin to open. Then begin incorporating your shoulders, rolling side to side with your head. As you continue to open, roll your knees, shoulders, and head in unison to create the maximum cross-fiber friction deep tissue effect. Continue in this manner down the neck to the upper back, stopping at a comfortable place in the upper thoracic region, usually somewhere around the third thoracic vertebrae or T3. The routine does not end here, but will continue by flipping the AcuLever orientation 180 degrees, which creates another angled cut on all of these muscles. The first position is again just under the skull at the top of the neck at the first cervical vertebrae. Reposition the AcuLever with the fin blades rotated 180 degrees from the previous technique, and lower your head so that it is centered between the fin blades. Rest here as long as it feels appropriate to begin the opening of this site. After this initial direct pressure, begin rolling your head side to side to create the deep tissue cross-fiber friction effect. You will feel the site begin to open. Then begin incorporating your shoulders, rolling side to side with your head. As you continue to roll, incorporate your knees, shoulder, and head in unison to create the maximum effect. From this oblique side view, the AcuLever's motion can be seen to accelerate as more of the body is incorporated into the rocking movement. There is no right amount of time to treat one site, as some sites will have more scar tissue adhesions than others, requiring extra therapy to open them. And some treatment sites will respond better to either the first or second blade position. In short, do whatever works for you to create the maximum effect for your body.